Oftentimes I'm told that the total gym is a great place to do squats, and I absolutely agree. The higher the incline, the more challenging the exercise becomes. But just when you're thinking of squats, we're using the closed chain platform here. Vary how you do the squat. Teach the person to go wide, to go staggered feet, to go narrow feet. Change your intention. Oftentimes I'm having a staggered position, but I'm not thinking about necessarily a strength. I might be thinking about the lower leg, really getting a calf stretch, and or building talocrural mobility. So moving from a squat, to progress this, we can have the feet parallel, and you can start with just having a toe touch of one foot, and then you can start to add increased weight. Remember, I can always decrease the incline. It's very easy with the power tower. I can bring it down. But I also want you to see, if you keep the incline the same, how you can take this exercise and just keep progressing. Then you might have the person press up, and then maybe control more eccentric with lifting the foot as you go. To progress again, the foot might then either be in the air, or to help stabilize the pelvis, you might also put it at the bottom edge of the glide board. So taking the squat and just building and building upon that concept of how you change the intention of the exercise, I'm going to go in now into plyometrics. It might be easier to start with a alternating plyometric if the person is challenged in their core more so than that of the lower extremity. If I feel like that is stable, what I'm going to start to do is start to add bilateral, because a bilateral at a higher incline level, you really need to have the stabilization of the trunk, and you have to watch for arching, overextending in the back. Then I'm going to progress with that control by alternating jumps, and then you can just do a single leg plyometric. Again, the higher you go, the harder it is. Now, if I want to add a core dynamic to it and still be working the legs, the lower you go, the more challenging the exercise becomes, more in terms of stabilization to the trunk, but you're definitely still working the legs. Another nice way I start to add the legs is I have the person come down into a squat, and then I have them just try to switch leg positions. So I'm holding a small range of motion, and then they try to switch, and they try to pick up that pace. And it's almost like they're jumping without moving the glide board, like a static equilibrium for squats. And then they come up a little bit more, and then they add that quick feet maneuver. It helps to add in when we're doing more weight bearing and we're doing more agility drills to start to challenge the feet in terms of timing. So coming from this position, think that you can also change the base of support. Remember, we have the BABS board, but sometimes I might even add in a BOSU. So I'll have us move his feet down, and you can just slide the feet down a little bit, rather the BOSU down, and then you can have it stable right at the bottom edge of the glide board, and you can add another unstable surface to give him more proprioception. So think about adding that in, or maybe even the BABS board and having them do squats there. Remember, with this closed chain platform, I'm going to have you transition your feet. So I'm going to move them to the side. Perfect. As that you can also go into calf raises. So I can add this element in. Remember, the lower it is, the less range. The more it comes out, the more range of motion. So he can put his feet here, and then he can do bilateral or unilateral calf raises. Building on this movement pattern of the legs, I might also use this as well to have his heels come either to the top edge of the squat stand, or if I'm using the closed chain platform, I'm going to have him maybe use the calf raise, and I'm going to have him keep his feet on the bar, and then I'm going to have him lift his rear end. So he's going to go into a bridge, and then he can just bring the glide board down and up. It's like doing bridging with the ball, but now it's a little bit, you're having one plane of motion, which can allow for more control. Then again, you can progress this by doing one-legged. You can start with a toe tap to one leg into the sky. You can focus more on a bridge, and or you can have that person lower their hips down a little bit more into neutral and have what's called a hip lift and really get into the hamstrings here. Moving on, of different ways you can activate the lower extremity is I'm going to have him lower his hips down. He's going to transition to the side. Now when you transition to the side, oftentimes people move up the glide board. So just have the person reposition and bring the glide board up the incline so that their hips are toward the bottom. Then you can have the option of where you want to put that foot. You can move the heel a little bit forward, and you're going more into a lunge. The bottom foot can be supporting or into the chest, or it can be out straight, whatever works for the patient. And you're going to slowly bend the knee and then press back up. So you're progressing this person by having them increase the resistance. Another way you can think about doing this side lunge position is this foot, bottom foot will come down, is if I'm working with someone who needs to do a deep squat for whatever job they have, for whatever sport they have, and I need to get them strong with a very deep squat, I'm going to move the foot back and lift the heel and start preparing them for that sport. For instance, a catcher or a goalie where they might need to be up a little bit, bent down. So start to think outside the box of very traditional movement patterns, and note that this is a great place to start bringing someone up and outside their comfort zone, but be partial weight bearing. Last but not least is think about the side plank as a great way to strengthen the hips. So you can have the feet either scissored or they can be together. You can have the board all the way at the top where it's absolutely in the closed position and stable. This is another place I use that side distance regulator to hold the board, or I'm here and now I'm just going to have them lift and lower the hips, really thinking about that outer hip for stabilization. So rather than just doing squats, start to expand your repertoire.